Hello everyone. Today we are going to discuss muscles of facial expression. The muscles of the head and neck are responsible for facial expressions, chewing, swallowing, head movement, and speech. They can be classified into different groups based on their location and function. Head and neck muscles are classified into muscles of facial expression, which control facial movements such as smiling, frowning, and blinking. Innervated by the facial nerve, which is cranial nerve 7. Muscles of mastication or chewing. Move the jaw for chewing and speaking. These are innervated by the mandibular branch of the trigeminal nerve. Muscles of the tongue. Control tongue movement for speech and swallowing. Innervated by the hypoglossal nerve, cranial nerve 12. Muscles of the pharynx and soft palate. Aid in swallowing and speaking. Mostly innervated by the vagus nerve, cranial nerve X. Muscles of the neck. Control head and neck movement, swallowing, and respiration. Innervated by multiple nerves, including the accessory nerve, cranial nerve 11, and cervical spinal nerves. First we discuss the muscles of facial expression. These muscles attach to the skin rather than bones, allowing fine movements of the face. The frontalis muscle is a thin, broad muscle located in the forehead region. It is responsible for raising the eyebrows and wrinkling the forehead, playing a key role in facial expressions. The frontalis is part of the larger occipitofrontalis muscle, which consists of two muscle bellies. Frontalis, anterior part, located in the forehead. While occipitalis, posterior part, located at the back of the head. These two parts are connected by the epicranial aponeurosis, Galea aponeurotica, a tendinous sheet that allows coordinated movement. The frontalis muscle originates from the epicranial aponeurosis and inserts into the skin of the eyebrows and forehead. The frontalis muscle is innervated by the facial nerve, specifically the temporal branch. Damage to the facial nerve can cause inability to raise the eyebrows or wrinkle the forehead, leading to facial asymmetry. The frontalis muscle receives blood supply from branches of the superficial temporal artery and supraorbital artery. Function of the frontalis muscle is to raises the eyebrows, creating expressions of surprise or curiosity. It wrinkles the forehead, contributing to facial expressions and communication. Frontalis muscle works with other muscles like the orbicularis oculi to control eyelid movement. Clinical importance of frontalis muscle. Facial paralysis, Bell's palsy, damage to the facial nerve can lead to loss of frontalis function, making it difficult to raise the eyebrows. Overuse of the frontalis muscle, such as frequent eyebrow raising, can contribute to tension headaches. Botox injections often used in the frontalis muscle to reduce forehead wrinkles by temporarily paralyzing muscle movement. That's the end of frontalis muscle anatomy. The occipitalis muscle is a thin, rectangular muscle located at the back of the head, forming the posterior part of the occipitofrontalis muscle. It plays a role in scalp movement and works together with the frontalis muscle to produce facial expressions. The occipitalis is part of the larger occipitofrontalis muscle. The occipitalis muscle originates from the superior nuchal line of the occipital bone and the mastoid part of the temporal bone. It inserts into the epicranial aponeurosis, allowing coordinated movement with the frontalis muscle. The occipitalis muscle is innervated by the posterior auricular branch of the facial nerve. This nerve helps control the movement of the scalp and nearby structures. It receives blood from the occipital artery, a branch of the external carotid artery. Function of the occipitalis muscle. It pulls the scalp backward, working with the frontalis muscle to create facial expressions. It assists in raising the eyebrows by stabilizing the epicranial aponeurosis. It also helps with scalp movement, which can be seen when you wiggle your scalp. Clinical importance. Facial nerve paralysis, Bell's palsy, can lead to loss of scalp movement and facial asymmetry. Muscle tension and headaches, tightness in the occipitalis can contribute to tension headaches. Botox treatments, although rare, Botox may be used in the occipital region for headache relief. The orbicularis oculi is a circular, sphincter-like, muscle surrounding the eye. It is responsible for closing the eyelids, blinking, squinting, and protecting the eye from external stimuli. This muscle is crucial for facial expressions and functions as part of the facial musculature. The orbicularis oculi consists of three main parts. Orbital part. The outermost part that encircles the eye. Responsible for forceful closure of the eyelids, such as during squinting or winking. Palpebral part. Located within the eyelids. Responsible for gentle eyelid closure, such as blinking or sleeping. Lacrimal part. Located near the lacrimal sac, in the inner corner of the eye. Helps with tear drainage by pulling the lacrimal sac medially. Origin and insertion. Orbital part originate from medial orbital margin, frontal bone and maxilla. And medial palpebral ligament. Orbital part inserts into skin around the orbit, eyelids and supraorbital region. And lateral palpebral raphe, which is fibrous band at the outer corner of the eye. Palpebral part originate from medial palpebral ligament. And inserts into lateral palpebral raphe. Lacrimal part originate from lacrimal bone, near the lacrimal sac. And inserts into medial palpebral ligament and tarsal plates of the eyelids. Nerve supply. Orbicularis muscle innervated by the facial nerve, cranial nerve 7, specifically the temporal and zygomatic branches. Damage to the facial nerve can result in inability to close the eye completely, logophthalmos, leading to dry eyes and corneal damage. Blood supply. Orbicularis muscle supplied by supraorbital artery, which arises from the ophthalmic artery, a branch of the internal carotid artery. It supplies the upper eyelid and forehead, including parts of the orbicularis oculi. Obriculari oculi also supplied by supratrochlear artery, which is another branch of the ophthalmic artery. It provides blood to the medial forehead and upper eyelid. Another artery supply the orbicularis oculi is lacrimal artery, which also originates from the ophthalmic artery. And it supplies the lacrimal gland, lateral eyelid, and nearby orbicularis oculi fibers. Three branches from the external carotid artery also supply the orbiculari oculi muscle, which include facial artery, a major branch of the external carotid artery. Gives rise to two important arteries supplying the orbicularis oculi. Angular artery and infraorbital artery. Second branch is superficial temporal artery. Provide small branches that help supply the upper face, including the lateral parts of the orbicularis oculi. Third branch is transverse facial artery. Arises from the superficial temporal artery. Contributes to the vascular supply of the lateral eyelid and orbicularis oculi. Function of the orbicularis oculi muscle. Eye protection, closes the eyelids to protect the eye from dust, light, and injury. Blinking, spreads tears over the cornea to keep the eyes moist. Squinting, helps in reducing glare from bright light. Tear drainage, the lacrimal part helps pump tears into the nasolacrimal duct. Clinical importance. Damage to different eye muscles can cause drooping eyelids, ptosis, or incomplete eye closure, logophthalmos. In Bell's palsy, facial nerve paralysis can cause inability to close the eye, leading to dry eye complications. Involuntary spasms of the orbicularis oculi cause excessive blinking or eye closure. This condition is called blepharospasm. Botox treatment, used in cosmetic procedures to reduce crow's feet wrinkles around the eyes. That's the end of orbiculari oculi muscle anatomy. The orbicularis oris muscle is a circular, sphincter-like, muscle surrounding the mouth. It is responsible for controlling lip movements such as closing, puckering, and pursing the lips. This muscle plays a crucial role in facial expressions, speech, and eating. The orbicularis oris is not a single muscle but a complex of interlacing fibers from other facial muscles. It consists of 4 quadrants, upper right, upper left, lower left, each containing superficial fibers that derive from other facial muscles, and deep intrinsic fibers responsible for lip closure and movement. The fibers of the orbicularis oris originate from the maxilla and mandible, bony structures around the mouth. Some fibers also originate from the modilus, a fibromuscular structure at the corners of the mouth. Orbicularis oris muscle insert into skin and mucous membrane of the lips. It blends with other muscles of facial expression, such as buccinator, zygomaticus, and depressor anguli oris. Orbicularis oris muscle is innervated by the facial nerve, cranial nerve 7. Specifically, the buccal and mandibular branches of the facial nerve control the movement of this muscle. Blood supply. Superior and inferior labial arteries, branches of the facial artery, supply blood to the muscle. Venous drainage occurs through the facial vein. Functions of the orbicularis oris muscle. Orbicularis oris muscle helps in sealing the lips. It helps in puckering and pursing the lips, which used in whistling, kissing, and playing wind instruments. Orbicularis oris muscle also helps in speech production. It helps articulate certain sounds, such as P and B. Orbicularis oris muscle keeps food and saliva inside the mouth while eating. Orbicularis oris muscle involves in facial expressions. It plays a role in smiling, frowning, and other emotional expressions. Clinical significance of orbicularis oris muscle. Bell's palsy leads to weakness or inability to close the lips properly. Cleft lip is a congenital defect where the orbicularis oris muscle does not fully form, affecting speech and eating. The orbicularis oris contributes to the formation of vertical lip wrinkles, smoker's lines, due to repetitive lip movements. Orbicularis oris muscle is also target for Botox and fillers, which involves in cosmetic procedures to enhance lip appearance. The zygomaticus major muscle is a key facial expression muscle that play a crucial role in smiling and elevating the upper lip. This muscle belongs to the muscles of facial expression group and is innervated by the facial nerve. Zygomaticus major originates from the lateral surface of the zygomatic bone, near the zygomaticotemporal suture. And it inserts at the modilus, a fibromuscular structure at the corner of the mouth. And also blends with the orbicularis oris, levator anguli oris, and risorius muscles. Functions of the zygomaticus major muscle. It elevates the corners of the mouth. This action is essential in smiling and laughing. It expresses emotions, involved in facial expressions related to happiness, amusement, and friendliness. It assists in speech articulation, helps in forming words that require lip movement and mouth widening. It supports facial aesthetics, maintains the contour of the cheeks and mouth. Nerve supply of zygomaticus major muscle. The facial nerve is responsible for the motor control of all muscles of facial expression, including the zygomaticus major. It originates from the brainstem, pons, and exits the skull through the stylomastoid foramen before branching into different divisions. Zygomatic branch arises from the main facial nerve as it passes through the parotid gland, travels superiorly toward the zygomatic bone. It innervates the zygomaticus major, zygomaticus minor, and orbicularis oculi muscles. Buccal branch of the facial nerve runs along the buccal fat pad and cheek region. It supplies zygomaticus major, levator anguli oris, and orbicularis oris. It plays a crucial role in controlling smiling and lip movements. Blood supply of zygomaticus major muscle. The facial artery is the primary arterial supply to the zygomaticus major. It arises from the external carotid artery and ascends along the face, supplying multiple structures. Superior labial artery, which is branch of the facial artery, supplies the upper lip, zygomaticus major, zygomaticus minor, and surrounding tissues. Another terminal branch of facial artery called angular artery travels toward the medial corner of the eye, providing additional vascular support to the zygomatic region. The transverse facial artery is a secondary source of blood for the zygomaticus major. It arises from the superficial temporal artery, which is a branch of the external carotid artery. Travels across the cheek, supplying the zygomatic and buccal region, including the zygomaticus major. Clinical relevance of zygomatic muscle nerve supply. Facial nerve palsy, Bell's palsy. which result from damage to the facial nerve cause paralysis of the zygomaticus major, leading to inability to smile properly on the affected side. Facial asymmetry with drooping of the mouth. Loss of voluntary and emotional facial expressions. Ramsay-Hunt syndrome or herpes zoster oticus is viral infection affecting the facial nerve, leading to zygomaticus major weakness and facial drooping. The zygomaticus minor is a thin, strap-like muscle located in the cheek region, running obliquely from the zygomatic bone to the upper lip. It works closely with the zygomaticus major but primarily elevates the upper lip, exposing the maxillary teeth. Zygomaticus minor arises from the lateral surface of the zygomatic bone, near the zygomaticotemporal suture, and inserts at the modiolus, a fibromuscular structure at the corner of the mouth. It also blends with the orbicularis oris, levator anguli oris, and risorius muscles. The zygomaticus minor is innervated by the facial nerve. More specifically, it is supplied by the buccal and zygomatic branches of the facial nerve. Damage to this nerve may cause facial asymmetry, affecting smiling and upper lip movement. Zygomaticus minor is supplied by superior labial artery, which is a branch of facial artery. Angular artery supplying the nasal region and upper cheek. Transverse facial artery, which is a branch of superficial temporal artery. Provides additional vascular supply to the zygomatic region. Infraorbital artery, which is a branch of maxillary artery, contributes minor blood supply to the muscle. Venous drainage of zygomaticus minor follows the same pattern via the facial and transverse facial veins. Clinical relevance. The zygomaticus minor contributes to the formation of the nasolabial fold. In cosmetic procedures, Botox injections may be used to soften this fold, but overuse can affect natural facial expressions. Dermal fillers are also used to rejuvenate the midface by addressing volume loss near this muscle. Zygomaticus minor also involves in Bell's palsy and facial paralysis. The zygomaticus minor is a key reference point in facelift procedures. The buccinator muscle is a thin, flat muscle located in the cheek region. It plays a crucial role in mastication, chewing, blowing, sucking, and facial expressions. It is sometimes referred to as the trumpeter's muscle because of its importance in blowing air through pursed lips, as in playing wind instruments. Buccinator muscle originate from alveolar processes of the maxilla and mandible near the molar teeth. It also arise from pterygomandibular raphe, a fibrous band connecting the mandible to the skull. Buccinator inserts into the modiolus, which is a fibrous structure at the corner of the mouth. It also blends with the orbicularis oris muscle, helping to control lip movement. Buccinator muscle aids in mastication, chewing. It keeps food between the teeth by pressing the cheek against the molars. It also prevents food from accumulating in the cheek area during chewing. Buccinator muscle facilitates blowing and sucking actions. It is important for infants during breastfeeding. It also used in whistling, blowing air, and playing wind instruments. Buccinator contributes to facial expressions. Helps in actions like smiling, laughing, and tightening the cheek. It prevents drooling, maintains oral continence by keeping saliva within the mouth. Buccinator muscle is innervated by facial nerve. Specifically, it is supplied by the buccal branch of the facial nerve. Unlike muscles of mastication, which are innervated by the mandibular nerve, CNV3, the buccinator is a muscle of facial expression. Facial nerve damage, e.g., in Bell's palsy, can weaken the buccinator, causing difficulty in keeping food inside the mouth and affecting facial expressions. Blood supply. The buccinator muscle receives blood supply from buccal branch of the facial artery and buccal branch of maxillary, which is its primary blood supply. Transverse facial artery also supply buccinator. The venous drainage follows a similar pattern through the facial and maxillary veins. Clinical significance. The buccinator is well developed at birth, allowing infants to suckle effectively during breastfeeding. A weakened buccinator may allow food to accumulate between the teeth and cheek, increasing the risk of dental cavities and gum infections. Buccellator muscle essential in pronouncing sounds that require lip control, e.g., p, b, m sounds. Used by wind instrument players and trumpeters for controlling airflow. The buccinator muscle may be affected in facial trauma, dental surgeries, or reconstructive procedures. Botox injections are sometimes used to relax this muscle in cases of excessive drooling or spasms. The platysma muscle is a thin, superficial muscle located in the neck and extends to the lower face. It plays a key role in facial expressions, particularly in lowering the jaw and tensing the skin of the neck. It is part of the muscles of facial expression and is innervated by the facial nerve. Platysma muscle originate from fascia covering the pectoralis major and deltoid muscle. And it inserts into lower border of mandible, skin of the lower face and muscles around the mouth. Functions of the platysma muscle. It tenses the skin of the neck, helps in expressions like fear, shock, or stress. It depresses the mandible, jaw, thus assists in opening the mouth slightly. It draws the lower lip downward, contributes to pouting or grimacing expressions. It protects underlying structures, covers the neck's vascular and muscular structures, offering minimal protection. Platysma muscle innervated by cervical branch of the facial nerve. Since it is a muscle of facial expression, it is not innervated by cervical spinal nerves but instead by the facial nerve. The platysma muscle is supplied by submental artery, which is a branch of the facial artery, and suprascapular artery, which is a branch of the thyrocervical trunk. Venous drainage occurs through external jugular vein, which ultimately drains into the subclavian vein. Clinical significance of platysma muscle. The platysma weakens with age, leading to visible vertical neck bands and sagging skin. This is a common concern in cosmetic dermatology and is treated using Botox injections to relax the muscle. Neck lift surgery to tighten the skin. Platysma cut during surgery. During neck surgeries, such as thyroidectomy or carotid artery procedures, care must be taken not to damage the platysma, as improper healing may cause scarring or asymmetry in the neck. Some neurological conditions may cause involuntary twitching of the platysma, observed in Parkinson's disease or after nerve injury. The depressor anguli oris is a superficial facial muscle that plays a role in lowering the corners of the mouth, contributing to expressions of sadness, displeasure, or frowning. It is part of the muscles of facial expression, controlled by the facial nerve. This muscle works alongside the zygomaticus major and minor, orbicularis oris, and risorius to control various lip and mouth movements. The depressor anguli oris originate from mandible at oblique line of the lower jaw. And inserts modialis at corner of the mouth and orbiculari oris muscle. Function of depressor anguli oris. It pulls the corners of the mouth downward, creating a frown or sad expression. It works with the platysma muscle to intensify expressions of distress or anger. Depressor anguli oris assists in speech and articulation by modifying lip movement. Overactivity of this muscle can lead to permanent frown lines, treated with Botox injections. Facial nerve paralysis, e.g., Bell's palsy, can cause asymmetrical expressions, where the affected side cannot depress the mouth properly. Depressor anguli oris innervated by mandibular or marginal branch of the facial nerve. Like other facial expression muscles, it is controlled by the facial nerve, allowing voluntary and involuntary movement. Facial nerve damage can cause inability to frown or asymmetrical expressions. The depressor anguli oris muscle receives blood from facial artery, which is its main blood supply. It also supplied by inferior labial artery, a branch of the facial artery. It also supplied mental artery, which is the branch of the maxillary artery. Blood drains via the facial vein, which ultimately empties into the internal jugular vein. Clinical importance. Facial expressions and psychological impact. The depressor anguli oris plays a crucial role in human emotions and expressions of sadness, anger, and frustration. Overactive depressor anguli oris muscles can lead to chronic frowning, giving a person an unintentionally angry or sad appearance. Cosmetic and surgical importance. Botox, botulinum toxin, injections are used to relax this muscle, reducing frown lines. In some cases, facial plastic surgery can reshape the lower face by adjusting this muscle. Neurological conditions. Facial nerve paralysis, Bell's palsy, can cause asymmetrical facial expressions, where the mouth is unable to depress on one side. Damage to the marginal mandibular branch of the facial nerve during surgical procedures can lead to permanent mouth asymmetry. The corrugator supercilii is a small but essential facial muscle located beneath the eyebrows. It plays a role in facial expressions, particularly in frowning and expressing concern or deep thought. The muscle draws the eyebrows medially and downward, creating vertical wrinkles on the forehead, often referred to as glabellar lines. Corrugator supercilii originate from the medial end of the superciliary arch in frontal bone and inserts at the skin of the eyebrow near the middle of the forehead. The insertion into the skin allows it to create furrows between the eyebrows. Function of corrugator supercilii. It draws the eyebrows inward and downward, creating a frown or worried expression. It shields the eyes from bright light, often activated when squinting. It also works with orbicularis oculi and frontalis muscles to regulate eyebrow movements. Corrugator supercilii innervated by temporal branch of the facial nerve. As a muscle of facial expression, it is controlled by the facial nerve, allowing for voluntary and involuntary movements. The corrugator supercilii muscle receives blood from ophthalmic artery, which is the branch of the internal carotid artery. It give two branches named supraorbital artery, supratrochlear artery, which supply the corrugator supercilii muscle. Blood drains into the supraorbital vein and supratrochlear vein, which ultimately flow into the cavernous sinus. Clinical importance. Facial expressions and psychological impact. The corrugator supercilii plays a key role in nonverbal communication, especially expressing concern, anger, or confusion. People with overactive corrugator supercilii muscles may appear angry or stressed, even when relaxed. Cosmetic and surgical importance. Botox injections are commonly used to relax the muscle, reducing frown lines. The glabellar complex, including this muscle, is often treated in facial rejuvenation procedures. Neurological and clinical conditions. Facial nerve paralysis, e.g., Bell's palsy, can cause eyebrow asymmetry. Tension headaches may be associated with overuse of the corrugator supercilii. The depressor supercilii is a small muscle of facial expression located near the eyebrow. It is often considered part of the orbicularis oculi muscle, though some anatomical studies recognize it as a separate muscle. It plays a role in lowering the eyebrow and contributing to frowning, aiding in expressions of sadness or deep thought. Depressor supercilii originate from medial orbital rim, near frontal process of maxilla and inserts at the skin of the medial eyebrow. Depressor supercilii lowers the medial part of the eyebrow, contributing to frowning. It works with the corrugator supercilii and orbicularis oculi in facial expressions of concern, sadness, or frustration. It assists in closing the eyelids tightly, helping to protect the eyes from bright light or foreign objects. Some anatomists debate whether the depressor supercilii is a distinct muscle or just a part of the orbicularis oculi. Depressor supercilii innervated by temporal and zygomatic branches of the facial nerve. The depressor supercilii muscle receives blood from ophthalmic artery, which is a branch of the internal carotid artery. It also supplied by supraorbital artery and supratrochlear artery, branch of the ophthalmic artery. Blood drains from depressor supercilii into the supraorbital vein and supratrochlear vein, eventually reaching the cavernous sinus. Clinical importance. Facial expressions and aesthetic concerns. Overactivity of the depressor supercilii contributes to glabellar frown lines, which are often treated with Botox injections. Dysfunction can lead to incomplete eyebrow movement, affecting emotional expressions. Neurological and clinical conditions. Facial nerve paralysis, e.g., Bell's palsy, can affect the eyebrow's position and movement. Tension headaches may be linked to excessive contraction of facial muscles, including the depressor supercilii. The mentalis muscle is a small but essential muscle located in the chin region. It plays a crucial role in facial expressions, particularly in pouting, protruding the lower lip, and expressing doubt or sadness. The mentalis muscle also helps in elevating and wrinkling the skin of the chin. Mentalis muscle originate from incisive fossa of the mandible, on either side of midline. It inserts on the skin of the chin. Function of the mentalis muscle. Mentalis elevates and protrudes the lower lip, creating a pouting expression. It wrinkles the skin of the chin, contributing to expressions of doubt, concern, or sadness. It helps seal the lips tightly, playing a role in actions like drinking from a straw or playing wind instruments. It also assists in lower lip movement when speaking or expressing emotions. Overactivity of the mentalis muscle can cause a pebble chin or golf ball chin appearance due to excessive wrinkling of the skin. Botox injections are sometimes used to relax the mentalis muscle and smooth the chin area. Mentalis muscle innervated by mandibular branch of the facial nerve. Since it is a muscle of facial expression, it is controlled by the facial nerve, which allows voluntary and involuntary movements of the chin and lower lip. The mentalis muscle receives blood from inferior labial artery, which is the branch of the facial artery, and submental artery, which is also a branch of the facial artery. Blood drains into the facial vein, which eventually connects to the internal jugular vein. Clinical importance. Facial expressions and aesthetic concerns. Overactivity of the mentalis muscle can lead to chin dimpling and excessive wrinkling. Dysfunction can result in difficulty sealing the lips, causing drooling or speech issues. Botox and dermal fillers are commonly used to relax or reshape the mentalis muscle for cosmetic purposes. Neurological and clinical conditions. Facial nerve paralysis can affect the mentalis muscle, leading to lower lip drooping and difficulty with lip movements. Bruxism, teeth grinding, may cause excessive tension in the mentalis muscle, leading to chin discomfort and headaches. The depressor labii inferioris muscle is a facial muscle responsible for lowering the lower lip, giving expressions of sadness, doubt, or irony. It is classified as one of the muscles of facial expression and works alongside other muscles to control lip movement. Depressor labii inferioris muscle originated from the outer surface of mandible, between symphysis and mental foramen, and inserts in the skin of lower lip, blendum with orbiculari oris muscle. Function of the depressor labii inferioris muscle. When depressor labii inferioris contracts, it pulls the lower lip downward and slightly laterally, exposing the lower teeth. It helps express emotions like sadness, doubt, or irony. It assists in actions like speaking and chewing, contributing to lip movement. It also works in coordination with the orbicularis oris muscle for lip control. Dysfunction of the depressor labii inferioris can result in asymmetry of the lower lip, affecting facial expressions and speech. Overactivity of the muscle can cause excessive lower lip drooping, sometimes treated with Botox injections for cosmetic corrections. Depressor labii inferioris muscle innervated by mandibular branch of the facial nerve. The depressor labii inferioris muscle is supplied by inferior labial artery and submental artery, which are branches of the facial artery. Blood drains through the facial vein, which eventually connects to the internal jugular vein. Clinical importance. Aesthetic and functional concerns. Overactivity of the depressor labii inferioris can cause an overly droopy lower lip, leading to a permanent sad expression. Botox or surgical treatments are sometimes used to correct asymmetry or excessive lip drooping. Neurological disorders. Facial nerve injury can weaken or paralyze the depressor labii inferioris, leading to difficulty in controlling lip movements. Stroke or Bell's palsy can cause one-sided lower lip drooping, making expressions appear uneven. The levator anguli oris is a facial muscle responsible for elevating the corners of the mouth, contributing to smiling and facial expressions of happiness or confidence. It works in coordination with other muscles, such as the zygomaticus major and orbicularis oris, to produce various facial expressions. Levator anguli oris originated from canine fossa of maxilla just below infraorbital foramen and inserts into the skin and muscles at the angle of the mouth bell ending with orbicularis oris and other muscles. Function of the levator anguli oris muscle. It elevates the corners of the mouth, helping in smiling and expressions of joy or confidence. It works with the zygomaticus major muscle to create a natural smile. Levator anguli oris helps in speech articulation and lip movement. It slightly pulls the corners of the mouth medially, distinguishing its role from the zygomaticus major, which pulls them more laterally. Weakness in this muscle due to facial nerve paralysis, e.g., Bell's palsy, can lead to an asymmetrical smile. Overactivity of the levator anguli oris can cause excessive pulling of the mouth corners, sometimes corrected using Botox injections in aesthetic medicine. Levator anguli oris innervated by buccal branch of the facial nerve. As a muscle of facial expression, it receives motor innervation from the facial nerve, allowing voluntary control of smiling and mouth movements. The levator anguli oris muscle is supplied by facial artery, especially branches like the superior labial artery and infraorbital artery, which is a branch of the maxillary artery. Blood drains through the facial vein, which eventually empties into the internal jugular vein. Clinical importance. Facial expressions and aesthetic concerns. Dysfunction of the levator anguli oris can cause facial asymmetry, affecting expressions and smiles. Botox and dermal fillers are sometimes used to correct overactivity or underactivity of the muscle for aesthetic purposes. Neurological disorders. Facial nerve palsy can affect the levator anguli oris, leading to difficulty in smiling symmetrically. Stroke or Bell's palsy may result in one-sided mouth drooping, making expressions appear uneven. The levator labii superioris muscle is a facial muscle involved in elevating the upper lip, playing a crucial role in facial expressions such as smiling, sneering, and showing disgust. It works in coordination with other muscles of facial expression, including the zygomaticus minor, orbicularis oris, and levator anguli oris. Levator labii superioris muscle originated from infraorbital margin of the maxilla just above the infraorbital foramen and inserts into the skin of upper lip and blends with orbicularis oris muscle. Function of the levator labii superioris muscle. It elevates the upper lip, helping in expressions such as smiling, sneering, or showing surprise. It works with the zygomaticus minor and levator anguli oris for lip movement control. It helps expose the maxillary teeth when smiling or talking. It assists in articulation during speech and enhances lip mobility. Weakness of this muscle due to facial nerve paralysis can lead to difficulty lifting the upper lip, affecting expressions and speech. Overactivity can cause excessive upper lip elevation, sometimes corrected with Botox for cosmetic purposes. Levator labii superioris innervated by buccal branch of the facial nerve. The facial nerve controls the levator labii superioris, allowing voluntary movements of the upper lip. The levator labii superioris muscle receives blood supply from facial artery, especially the superior labial artery. An infraorbital artery, which is a branch of the maxillary artery, also supply levator labii superioris. Blood drains through the facial vein, which eventually connects to the internal jugular vein. Clinical importance. Facial expressions and aesthetic concerns. Dysfunction of the levator labii superioris can cause facial asymmetry, leading to difficulty in smiling and expressing emotions. Botox injections may be used to control excessive upper lip elevation in cases of gummy smiles. Neurological disorders. Facial nerve paralysis, e.g., Bell's palsy, can impair upper lip elevation, causing asymmetrical expressions. Stroke or trauma to the facial nerve may result in inability to lift the upper lip on one side, affecting both facial expressions and speech. The risorius muscle is a thin, superficial muscle of facial expression located in the cheek region. It plays a role in pulling the corners of the mouth laterally, contributing to expressions such as smiling and grimacing. Unlike many other muscles of facial expression, the risorius does not insert into the skin of the lips, making it unique in its function. Risorius muscle originated from fascia over the masseter muscle and inserts into the skin at the corner of the mouth, modiolus. Function of the risorius muscle. It retracts the angle of the mouth laterally, helping form an insincere or forced smile. It assists in widening the mouth when expressing emotions such as grimacing or nervous laughter. It works with zygomaticus major to create a full smile, though the risorius alone produces a more subtle, horizontal smile. Overactivity of the risorius muscle can contribute to a stretched or unnatural smile. Weakness in conditions like Bell's palsy can lead to asymmetry of facial expressions. Risorius muscle innervated by buccal branch of the facial nerve. The facial nerve controls the risorius muscle, allowing voluntary smiling and mouth movement. The risorius muscle is supplied by facial artery, especially its branch superior labial artery, and transverse facial artery, which is a branch of the superficial temporal artery. Blood drains through the facial vein, connecting to the internal jugular vein. Clinical importance. Facial expressions and cosmetic concerns. The risorius muscle is involved in smiling and expressions of insincerity. Botox injections can be used to modify the appearance of the smile by reducing excessive lateral retraction. Neurological disorders. Facial nerve damage can impair the function of the risorius, causing difficulty in producing a symmetrical smile. The levator labii superioris oblique nasi is a thin, elongated facial muscle located near the nose. It is responsible for elevating the upper lip and dilating the nostrils, contributing to expressions like snarling or disgust. Due to its function in nostril dilation, it is sometimes called the Elvis muscle, referencing the famous lip curl of Elvis Presley. Levator labii superioris oblique nasi originated from frontal process of the maxilla near the nasal bone. It divides into two slips, one inserts into the upper lip and the other into the alar cartilage of the nose. Function of the levator labii superioris oblique nasi. It elevates the upper lip, making the teeth more visible, used in expressions of surprise or disgust. It dilates the nostrils, assisting in forced breathing or emotional expressions like anger. It works with the levator labii superioris and zygomaticus muscles in smiling. Overactivity of this muscle can contribute to a gummy smile, where excessive upper lip elevation exposes the gums. Weakness in conditions like Bell's palsy can result in difficulty lifting the upper lip, affecting expressions and nasal breathing. Levator labii superioris oblique nasi innervated by buccal branch of the facial nerve. The levator labii superioris oblique nasi muscle is supplied by facial artery, especially the superior labial artery. Infraorbital artery, which is a branch of the maxillary artery. Blood drains through the facial vein, eventually reaching the internal jugular vein. Clinical importance. Role in facial expressions and cosmetic concerns. The LLSAN muscle is often involved in expressions of disgust, anger, or deep breathing. Botox injections can reduce excessive upper lip elevation, treating gummy smiles. Neurological disorders. Facial nerve paralysis, e.g., Bell's palsy, can impair the function of this muscle, making expressions appear asymmetrical. Breathing and nasal function. The LLSAN muscle plays a role in widening the nostrils, helping in inhalation. Dysfunction can lead to narrowing of the nasal passages, affecting breathing. The procerus muscle is a small, triangular muscle of facial expression located between the eyebrows, on the bridge of the nose. It contributes to expressions of concentration, frowning, and anger by pulling the skin between the eyebrows downward, creating horizontal wrinkles across the nose. Procerus muscle originated from fascia over the lower part of the nasal bone and inserts into the skin over the lower part of forehead, also called glabella region. Function of the procerus muscle. It pulls the skin between the eyebrows downward, causing horizontal wrinkles on the nose. It contributes to frowning and squinting, aiding in expressions of anger, confusion, or deep thought. It works with the corrugator supercilii muscle to form vertical wrinkles on the forehead. Overuse of the procerus muscle contributes to the formation of glabellar, frown, lines, which are common in aging. Botox injections are often used to relax this muscle and reduce wrinkles. Procerus muscle innervated by temporal and buccal branches of the facial nerve. The procerus muscle receives blood from facial artery, mainly the angular artery branch, and ophthalmic artery through its supratrochlear and supraorbital branches. Blood drains through the facial vein into the internal jugular vein. Clinical importance. Role in facial expressions and aging. The procerus muscle is responsible for frown lines across the nose. Over time, repetitive contraction can cause deep wrinkles, which are often treated with Botox. Cosmetic procedures. Botox injections are commonly used to relax the procerus, smoothing out glabellar wrinkles. Some facial rejuvenation surgeries may involve targeting the procerus to create a more youthful appearance. Neurological disorders. Dysfunction of the facial nerve can lead to asymmetry in facial expressions due to weakness of the procerus. Hyperactivity in the procerus can contribute to chronic headaches and tension. The nasalese muscle is a small yet important facial muscle responsible for controlling the shape and movement of the nostrils. It is part of the muscles of facial expression and plays a crucial role in respiration and facial expressions. The muscle consists of two distinct parts. The alar part of the nasalese, also known as the alar nasalese or dilator nares posterior, is one of the nasalese muscle parts. It is classified as the nasal facial muscle. The alar nasalese is located in the wing of the nose, and it forms the nostril. This muscle dilates the nostril. The transverse part of the nasalese, also called the transverse nasalese or compressor nares, is one of the nasalese muscle parts. It is classified as the nasal facial muscle. The transverse nasalese covers the dorsum of the nose and compresses the nostrils. Origin and insertion of alar part of nasalese muscle. The alar part of the nasalese muscle, which shown blue here, originates from the frontal process of the maxilla above the region of the maxillary lateral incisor tooth. The alar nasalese inserts into the skin along the wing of the nose. The alar nasalese muscle lengthens the nose and dilates the nostril. Origin and insertion of transverse part of nasalese muscle. The transverse nasalese muscle, which shown green here, arises supralateral to the incisive fossa of the maxilla, and inserts into the aponeurosis of the bridge of the nose and blends with the fibers of the opposite transverse nasalese muscle. The transverse part of the nasalese is responsible for compression and closure of the nostrils. It also wrinkles the skin covering the bridge of the nose. In respiratory distress, the nasalese muscle is overactive, leading to nasal flaring, a sign of breathing difficulty in conditions like asthma or COPD. Nasalese muscle innervated by buccal branch of the facial nerve. Like all muscles of facial expression, it is controlled by the facial nerve, allowing voluntary and involuntary nostril movement. The nasalese muscle receives blood from lateral nasal artery, which is the branch of the facial artery. Another artery, infraorbital artery, which is a branch of the maxillary artery, also supply nasalese muscle. Clinical significance. Nasal breathing and athletic performance. The nasalese muscle helps optimize nasal airflow, which is important in athletes who rely on efficient breathing. Overuse can cause muscle fatigue, leading to nasal congestion. Cosmetic and surgical importance. The nasalese muscle is sometimes targeted in rhinoplasty, nose surgery, to modify nostril shape and function. Botox injections can relax overactive muscles in people with excessive nasal flaring. Pathological conditions. Overactivity may cause chronic nasal flaring, seen in respiratory distress. Weakness or paralysis results in reduced nostril movement, common in facial nerve damage. The depressor septi nasi is a small muscle of the nose that plays a role in controlling nasal movements. It works by pulling the nasal septum downward, which can affect the shape of the nostrils during facial expressions and breathing. Depressor septi nasi muscle originated from incisive fossa of the maxilla above the central incisors and inserts into the nasal septum and posterior part of the alar cartilage. Function of the depressor septi nasi muscle. It pulls the nasal septum downward, affecting the position of the nostrils. It works with the nasalis muscle to control nasal movements, especially during deep breathing and facial expressions. It assists in narrowing the nostrils and helps with facial expressions like disgust or concentration. It also plays a role in lip movements, as it is connected to muscles of the upper lip. In some individuals, overactivity of this muscle can lead to an undesirable nasal appearance during speech or smiling, often called a drooping nose tip. Botox injections are sometimes used to reduce excessive nasal downward movement. Depressor septi nasi muscle innervated by buccal branch of the facial nerve. The depressor septi nasi muscle receives blood from superior labial artery and lateral nasal artery, which are branches of the facial artery. Blood drains through the facial vein, which empties into the internal jugular vein. Clinical importance. Role in facial expressions and breathing. Helps in controlling nasal movements, especially in expressions involving the upper lip and nostrils. Works with the nasalis muscle to assist in nasal dilation and constriction during breathing. Cosmetic procedures. Some individuals have excessive activation of this muscle, causing downward movement of the nasal tip during smiling. Botox injections are used in aesthetic treatments to prevent nose tip drooping. Surgical procedures may target this muscle for rhinoplasty, nose reshaping surgeries. Speech and nasal function. The depressor septi nasi can influence nasal airflow, affecting the resonance of speech sounds. Dysfunction or hyperactivity of this muscle may impact nasal symmetry and breathing. The compressor naris minor, also called compressor narium minor, is a small and relatively less studied muscle of the nose. It plays a role in modulating nostril shape and is part of the nasal muscles responsible for facial expressions and nasal airflow control. Compressor naris minor originated from anterior surface of the maxilla near the nasal notch and inserts into the skin and cartilage of nasal septum. Function of the compressor narium minor muscle. It compresses the nostrils by pulling the alar cartilage closer to the nasal septum. It works with the compressor naris and nasalis muscle to control nostril dilation and constriction. It affects nasal expressions, especially in emotions like anger or concentration. It also plays a minor role in respiratory modulation, especially during forced breathing. Weakness in this muscle can contribute to nasal flaring or asymmetry. It is often overlooked in cosmetic and reconstructive nasal procedures but plays a subtle role in nostril shape. Compressor narium minor innervated by buccal branch of the facial nerve. The compressor narium minor muscle is supplied by superior labial artery and lateral nasal artery, which are the branches of facial artery. Blood drains into the facial vein, which connects to the internal jugular vein. Clinical importance. Role in facial expressions and breathing. It subtly contributes to nostril shape and airflow control during forced breathing. Works with the nasalis and depressor septi nasi muscles for coordinated nasal movement. Cosmetic and medical considerations. Some individuals have excessive nasal movement, which may be targeted in Botox procedures. Rhinoplasty surgeries sometimes involve minor modifications to this muscle for nostril reshaping. Functional impact on breathing. Dysfunction may contribute to nasal breathing difficulties in some individuals. Sometimes involved in nasal obstruction conditions where nostrils collapse excessively. The dilator naris anterior is a small muscle located in the nasal region. It is a part of the nasalis muscle and works to dilate, widen, the nostrils, allowing for better airflow. This muscle is particularly active during deep breathing, exercise, or emotional expressions like anger or surprise. Dilator naris anterior muscle originated from maxilla above and lateral to the incisor teeth, and it inserts into the skin and cartilage of nostrils. Function of the dilator naris anterior muscle. It expands the nostrils by pulling the lateral alar cartilage outward. It works with the dilator naris posterior and levator labii superioris alique nasi to enhance nasal airflow. It helps in forced inspiration, aiding in deep breathing during physical exertion. It contributes to facial expressions, especially those related to breathing effort, surprise, or anger. It also plays a minor role in speech and phonation, as nostril movement can affect airflow dynamics. Hyperactivity of this muscle can lead to flared nostrils, while weakness can contribute to nasal collapse or breathing difficulties. Dilator naris anterior muscle innervated by buccal branch of the facial nerve. The dilator naris anterior muscle receives its blood supply from superior labial artery and lateral nasal artery, which are the branches of facial artery. Its veins drains into the facial vein, which connects to the internal jugular vein. Clinical importance. Role in breathing and exercise. Active during forced breathing, such as exercise or respiratory distress. Dysfunction may be linked to nasal breathing difficulties or obstructive airway conditions. Cosmetic and surgical considerations. Overactive nasal flare can be corrected using Botox injections. Rhinoplasty surgeries sometimes alter this muscle to improve nostril symmetry. And that wraps up our look at the muscles of facial expression. Thanks for watching.